Yeah, hello, can you hear me? Hello? Can you hear
Hi,
me?
sir. Yes, sir.
Good. Okay, fine. Why are we around?
Yes, sir, we are around.
Okay. If Y is around, let's hear from Tamale. Tamale, are we there? Tamale, are we there? Tamale, are you there? Wow. No one from Tamale. Yeah, Tamale, are you there?
Tamale, we are there.
Yes, sir, we are there. We are there.
Okay, keep quiet.
We are
We
there.
are there.
See, that's why they mute
We are
you.
there. Keep quiet.
Simple question. Yes.
We are there.
Okay, fine. Let's move on to Keta. Keta, are you there?
Yeah,
We are here,
there.
sir.
We
are
here.
Okay. Keta is there. Asanko. Asanko, are you there? Asanko, are you there? Asanko.
Sir, we are there.
Okay. Sanko is there. We thank God. Kofi Kenata people. Tadi.
Sir, we are here.
Where was I? Okay. Okay. It's good hearing from you. It's good hearing from Takrade. Is there any center not mentioned? Is there any center not mentioned?
There you not mention
Oh, I started with Wa.
What was first?
So okay. So now I know that you are Wa, Tamale, Keta, Sanko, and then of course Takradi people. So now I know that the others are not part of you. So I know the trick. Okay. So I've loaded some PowerPoint to your page. Have you been able to go through? 2 different PowerPoints. Have you been able to go through?
Sir.
Have you been able to go through? Yes.
Sir, please, I'm unable to join the Telegram page. When I click on the link, it tells me to start chat. Then it brings me back to WhatsApp where I had a link from.
Okay. Please, reps. Somebody has difficulty joining the Telegram page. Can you help her? Group C reps, how are you?
Sir, please, she should contact her center rep.
Okay, so my dear, they say contact the center rep, okay? And who's the center rep? Can you mention the name so that we can all hear? Who's the center rep?
Sir, please, she's Fenumeri Enam.
Enam and who?
And Beatrice.
Enam and Beatrice. If you're on the page, please attend to my dear sister, okay? She needs to join the page. Okay, good. Any other complaint? Have you read through the PowerPoints, please? It was loaded yesterday. Or you've not seen it at all?
So we've seen it.
So have you gone through? Have you gone through?
Not yet.
Yes, sir.
Okay. Okay, that's nice. So, we're going to start straightforward from the male reproductive system. As for the others, we already discussed. Okay. Okay, so before I even start with the PowerPoint, let me ask you one question, and let's see your reaction to it. Now, there are two men. Two men. Man A is a very rich man. Very rich. He has all the sort that ladies can like. But sexually, there's a problem. He can't give birth. Erection is somehow weak, but he has money. It's very important. Even erection is somehow weak, but he has money. And then we have man B. Man label B is not financially well sound. He's, let's say, poor. I'll categorize him as a poor man. But he's very sexually active. Okay? Very sexually active, very potent, and everything sexually you want. Now, between these two men, man A and man B, the rich and the poor, the sexually inactive, impotent, and then the sexually active and this. Among these two gentlemen, whom would you choose? Lydiaka.
Say, you choose the money, then you cheat outside. Simple. Sikalo, yeah, the way cheat outside. Simple.
Oh, this can make the outside. Okay.
Say, money is the root of all evil. Yeah, you know, I'll choose money.
Oh, security na your course in there, why a mistake. Course, you're my friendship. Okay. You better say, yes, you may see, you better who didn't my friendship. Okay. Eunice, what would you do?
I will forgo the rich man and then choose the poor man. The poor man will one day definitely get rich. So I'll choose the poor man.
How do you know the poor man will be rich? How?
Sir, we will work together. I'll help him.
If you want to know the character of a man, give him money. When man have money, their character change. Money changes people. So, well, so you choose the B. It's nice. Let's hear from Bill. Bill. Yes. Oh, your hand is up. Edith. Edith, are you there? Okay. If Edith is not there, let's hear. Now, the testing, people are testing some funny things. Eunice, Malayo, money make the relationship stronger. Hey, Sheila, what's your problem? You can say her mind. Sheila, what problem is there? Huh? Okay, Sadia, let's hear from you, Sadia.
I will choose the poor man.
Sadia, you choose the poor man. Okay, any reason for that? Any reason?
At least if she's satisfied, no need for them chopping their money and go out and cheat.
Hey, so because of cheating, you marry a poor man so that he can satisfy you alone. Oh, Sadia. Hey, yo, Mate. Juliet, let's hear from you.
So I'll choose the poor man.
You do what?
I'll choose the poor man. I'll choose the poor man because for my satisfaction, it should be achieved. And with the little I have, we can manage and then be happy. But for the impotent man, you will never be happy. Money cannot satisfy you sexually. So I'll choose the poor man.
Okay, that's your Khadija. Khadija?
Sir.
Yes.
Please, I will go in for the rich man. Because even maybe there can be treatment. So you can go through hospitals and other things that he can get treatment. But I say after sex, if you don't eat, the way it's like you'll be feeling dizzy. So there is better than the
Okay. Okay. Let's hear from Ruth. Ruth Jaben.
Okay, thank you, sir. Please, I'll go for the rich man. As my sister said, we'll use some of the money to go for treatment and enjoy. Thank you.
You see, the commenters very first comment that I'm reading. Hey, money will give you financial orgasm. Hey, Faustina Moro, financial orgasm. More. Fausti, with a transformer, like a financial orgasm. Hey. Wow. I've never heard that word, though, financial orgasm. Okay. Fine. So it means that if you are supposed to vote, there will be a bit of A and B. Or do you think that A will take over the vote if you are supposed to? Well, listen to your views. Some will go for the poor, others will go for the rich. All the way is their choice. I reject poverty, comfort. I reject poverty. Hey, no. It seems there's a trend in this one. It seems the married one are especially going for a particular man, and the unmarried one are going for other people. Or it's not the trend. Victoria, what's the trend?
Hello, sir. Hello. Please,
yes, go on.
Yeah, I would rather go for the poor man. It goes to God. God, the whole world is in the hand of God. Whatever the poor man is having, God can deal with it. I will take the poor man and we pray to God, and God will correct everything.
Hey, okay. So for mommy.
Yes, Victoria, the so for mommy, that's good.
So for mommy. So for mommy has spoken.
Okay, at least that's her view, and she's entitled to it. Grace Oseata, Grace, what would you do? Grace.
Sir. Sir.
Yes.
Me, I don't know which one I'll pick. Oh.
You do what?
I don't know which one I'll pick.
And you are laughing. You are laughing at people's decision. You yourself, you've not made a decision. So, Grace, are you married?
No, please.
So, if you are there, these two men comes, you don't know who to choose.
I'm still contemplating. If anything, I'll come on
let
board.
me help you out. Grace, what's your laterality? Are you left-handed or right-handed? Let's do that and let's see.
I'm right-handed.
Well, you're right-handed?
Yes.
Are you sure that you're not left and you're forced to be right?
No, I'm right.
How do you wash things? Which hand is up when you are washing?
The right one.
Good. And when you are in the kitchen, which hand do you use to do your things?
Most the right one.
Okay. Bilaterally right. And you can make a decision. Right people should make decision. Those who were left and they were forced to make right.
For me, me, I'll go for man B.
You go for what?
Man B.
Man B, the poor one.
Yes. Yes, boss.
Okay. For what reason would you do that?
I said I don't know. I know. Let me come back later.
I'm not coming back. I'm on you. A nice lady like you are going for a poor man. So people are saying poverty is a disease. She's lying. Stella is telling you are lying. Salina Tufo is saying you are lying. Grace.
Hey, don't mind her. She's my colleague. She's lying.
Say you are lying. You won't go. Because looking at you, the person you date, you won't go for a poor man. That's what she's saying. Grace. Okay. Precious, let's hear from you.
Say me, I'll go for a rich man, because when a poor man gets money, he will choose another person over you. He will not tell you are not his class. So me, I'll go for ready-made.
But remember, the rich sexually, and you, papa.
So you go for treatment.
Okay.
It's better to cry in money than to cry in poverty.
Serious. It's better to cry in a Lamborghini than in a taxi.
No, man, you are finished. You're not supposed to.
Okay. It's like if you people read their comment that some of your colleagues are passing. Hey, serious. We see poor man, obedi ne one see their koto sex drug. Abejina also ama hey. Sembeni. So why? Does it mean that you ladies don't like sex? I'm a bit surprised. You don't like sex, you like money.
You like money more than sex.
You like money more than sex. Wow.
Money is more important than sex.
Let's go through. Don't worry. Let's go through the whole thing. When you go through male and female reproductive system, you understand certain things. Some of you have hormonal imbalance. That's why you don't like sex. Okay? Let's go through. When you know what the hormones are supposed to do, then let's see how the whole concept is. Okay, that's why I started with those two scenarios. Just to see the student I'm teaching, their mind. But it's a free will. No matter what I do, people go for a rich person. Yesterday, somebody told me she should go for the rich person and cheat with the gate man.
Yes, that's what I was about to say. They will go for the rich person and cheat on him.
That's what I was about to say too.
And she told me, oh, that's what I'll do. I'll go for his money and cheat with the gate man. I said, then why are you getting assembly? So that's a serious issue. Okay. But remember, that somebody who is rich and impotent, when he see you in that act, he won't say anything. No, he won't. He will kill you. He will kill you and bury you. No one will know. He's rich. So be careful. Those who are rich are very powerful people. Okay? When they see you cheating, we have rich men that their wife cheat. You know how they end? They end up disappearing from the country. They tell them, I've sent her abroad. They are dead. Okay? So rich people want to cheat. Stay with your rich. Don't cheat. Because if you cheat, he gets you, you are down. He will kill you. Okay? He will never find out. You say rich people don't talk much. They will know, but because they can't do it, they will suspect it already. And they are not jealous people. They are not jealous, so they will know. Okay? Okay, money answers it all. That's true. Money answers all, but death doesn't answer death. Okay? Okay, so hey, you are cheating with sense. Victoria, and you are cheating with sense. Hey, wow, cheating with sex. Sense power cheating. That's a bit true, because when a lady cheats, it takes God to reveal it to you. You will never know. If God does not tell you, no one will tell you. Okay? Because when a man cheats, it's something small. Every lady will know. Okay? But when a lady cheats, it's God that will reveal it to you. You will never know. As we go along, I'm going to explain why. Why will men find it difficult to even see ladies who are cheating? Somebody once told me that the bad girls get good husbands and the good girls get bad husbands. So it's better for her to be bad so that I can get good husband. I'm saying your bad one will end you in hell because you get bad. So it's anybody's aspect, anybody's choice. These are scenarios that people are living with. People's husbands are poor, but they are satisfying them. Others are rich, but they are crying every night. That's what is happening. Those of us in this seat, we hear so many complaints here and there. People are threatening divorce because of sex. People also threatening divorce because of poverty. So who should we consider? Oh, please spell us. I'm going to perform some. Some can't even impregnate. Me say the man cannot impregnate you. That's why I told you. Sexually, he's not even. The erection is even weak. He can't penetrate. So, but he's rich. He's rich. So let's sit with the rich aspect and let's continue. Okay, good. So let's look at the whole scenario this time. Have you been able to go through the PowerPoint, the male reproductive system? Poverty is never an option. Hey. Yo, I hope you ladies are rich. The way you are dragging the poverty thing. So it means you yourself, you are rich. Aren't you rich? I'll take the rich person because I'm rich myself. Yvonne, you should be rich, oh, because the way you are dazing the poverty people, the poor people, you should be rich. Okay, let's start our lecture. Since the ground is set, let's see what's going to happen. My focus on male reproductive system is not on the entire scenario. I'll be hammering on 3 important parts, where the production of the sperm cell, their transportation, and the semen analysis, okay? And then I'll be talking about erectile dysfunctions and few aspects related to the penis, okay? But I will mostly hammer on these 3 aspects: production of sperm cell, transportation of it, and then, of course, storage, transportation, and then the last aspect, okay? Semen analysis. So that's what we're going to do. Can you see the PowerPoint? Can you see it?
Yes, sir.
Yes, sir.
Yes, sir.
Good. Let's start our journey. Now, when talking about male reproductive system, you see, when a man is standing, you can see certain part of the reproductive system. Others, you can feel it. Some parts, you can't see it at all. So let's start with the part you can see. Can you tell me 1 or 2 parts that you can see when a man is standing naked?
The testis inside the sac.
You can't see that one. That one you can't see.
You can't see it.
I'm saying those that you can see.
Okay, so the penis and the scrotal sac.
Is that all? Julie says that the penis and the scrotal sac, that's all what she can see. Is that all? Is that all? Okay, let's go to those that we can feel. Those that you can feel. Okay, some are adding the orifice, urethral orifice. We call it the meatus. You can see that. We can see the hair. We can see all these things. Where you swana? Juliet, your boyfriend or your husband? Why you so? Where's Sakura?
Where you so?
It's not who you know. You're able to see the hair, see the orifice, see the gland. The gland. The gland. You should be able to see all these parts. Okay, good. Now tell me those that you can feel. Those that you can feel. You can feel. Julie, your hand is still up. Do you want to come again? Those that you can feel.
Sir, please, the testis.
You can feel the testis.
And if you palpate the testis, you can feel some.
Where again?
Is it vein?
Some veins. Right, Julie.
Yes.
Julie. You can feel veins.
It's true.
How do you know it's a vein? It's not actually a vein. It's a duct.
Wait. It's a duct. Okay.
It's a duct. Okay. Hey, vein.
I'm having practical, so.
Okay. So, who again? Apart from Julie's hand that is up, I can't see any other hand. Either you people are not married or don't have boyfriends, or you're not sexually active. Why? Are you virgins?
Yes.
Which one is yes?
Yes. We are virgins.
Is it secondary virgin or tertiary virgin?
Tertiary virgin.
Okay. So when a man is standing, you can see certain parts that have been mentioned. Remember, we can feel others. We can see the epididymis, we can feel the testis, we can see the ducts, the vastus efferent, the one that we can use for vasectomy. You can feel them. Okay? Which part you can't see at all? Can you mention any part that you can't see, you can't feel at all? You can't see, neither can you feel at all. You can't see, neither can you feel. Any part in mind? Oh, the ureter. The ureter. When you say ureter, is urinary system. Okay. The urethra. That is reproductive system. Okay. Okay. Oh, please, semen. Don't bring semen here. Semen is not part of the structures. It's produced. Okay. I've heard Veronica, she said prostate. Yes. You can't feel, neither can you see. Okay, Jennifer, your hand is up.
Yeah, please. The seminal vesicle.
The seminal vesicle.
The ejaculatory duct.
You can't see it. You can't feel it.
Yes. And the ejaculatory duct.
Ejaculatory duct. What again?
The bulbo urethra glands.
Bulbo urethra. We call them the accessory glands. Accessory glands. Seminal vesicle, prostate gland, bulbourethral gland. They are all called accessory glands. Okay. So basically, we can see the general organs like the penis, the gland, the orifice, the meatus. We can see the scrotal sac. We can even feel the testes, the epididymis, the duct. We can feel them. But when it comes to the accessory gland, you can't see, neither can you feel. I hope when we ask you simple questions like these, you can answer them. Okay. Good. So now that we know which one, let's move on. Now, so that's why it's on your screen. Okay. Accessory sex glands, we can see, we can feel them. Okay. So this is it. So this is the hair that I was talking about, the pubic hair. For Juliet's husband or boyfriend is shaved, so it's a coda. Okay. So now this is it. Now, if you ask you the second question, where are sperm produced? What would you say? Sperm cells. Where are sperm cells produced? If you know, you raise your hand, please. Where are sperm cells produced? Where are sperm cells produced? Hey. Answer that. Let's go. Okay, sperm cells produce. Florence.
Sir, please. It's produced in the epididymis.
The epididymis?
Yes, please.
Florence, where are you from? The voice seems familiar.
Sir, please, I'm in Cape Coast now.
Oh, in Cape Coast. So you are Fanti, eh?
Yes, please.
Because I have a Florence at my workplace, and then the way your answers are, Florence for no, just say okay. As we go along, you understand later. Okay. A lot of people are saying testes. Somebody even said testicles. This time, we don't say testicles again. Please, who is that person? Rahina too. The patriarchal. And cat testicles be a colloquial. The gonads. The male gonads. Hey, also known Victoria. And then those who are saying testes. So it means that most of your answers here, I'll classify them as diploma answers. Okay? Because when it said that it's produced in the testes, actually, when you go to the testes, there's an exact part that the sperm cells are produced. Okay? So I would say this is
in the seminiferous.
Yes, come again.
Tubules.
Who is that?
The seminiferous tubules.
Where is the seminiferous tubule? Where is it located?
It's inside the testis. It's
exactly
inside,
where?
At the lower part of the testis.
Hey, Google answer. That's true, but it's a Google answer.
Google answer.
But it's not at the lower part. It's not like at the lower part. Let's look at the cross section of the testis. Let's look at the cross section. Let's look at it. Now, this is a cross section of the testis. Okay. No, seminiferous tubule is this one. You see the tubes that are coiled. The tubes that are coiled. That's the one we call seminiferous tubule. It's not at the. It's everywhere in the testis. You see, when they are operated like this, we call them lobule, and they are separated by septa. So this is a septa separating the two lobules. And inside the lobule, we have coiled seminiferous tubule. So my dear, You saw why, you can see now why I'm saying it's Google answer. Okay. Because what you said doesn't follow the anatomical arrangement. So when they cut through testes, we have this particular septum arrangement, a septa that's separating each part, and each part is called a lobe. And inside the lobe, we have a coil semiferous tubule. Testes are produced in the semiferous tubule. Sperm cells are produced in the semiferous tubule. Okay, sperm cells. Sorry for that. The sperm cells are produced inside the semiferous tubule. So when they ask you and you say that inside the testis, this part is called the retitestis. This is so there are so many parts. So which one are you looking for? I'm looking for the semiferous tubule. And semiferous tubule is the one that forms lobe. Each lobe can produce about millions of sperm cells. Each lobe. So if you have 1, 2, 3, 4, 5, 6 lobes in here, it means this testis alone can produce about 6,000. Okay, 6 million. Okay. So that is at ejaculation. So if it's ejaculated 3 or 4 times, it means that one can produce about 100 or over 1,000. So it means that a male with 1 testis can impregnate more than 1,000 ladies if given the chance. A male a male having 1 testis is enough to impregnate over 1,000 ladies if given the chance. So if the testis does not descend in infancy, and then you realize that the baby has only 1 testis, because the other one, the one that is active, can do the job. We don't need both to pregnate women. We need only 1. Okay? So that is the whole concept I want you to understand. Okay? That's the concept I want you to understand. Sperms are produced. Now let's look at the lobe. When you have a lobe like this, you can see coiled of semiferous tubule. And we have spaces within the lobe. We call them interstitial space. Interstitial space. In that space, we have another cell that we call Leydig cell. Interstitial space of Leydig cell. Okay? So the Leydig cell is not inside the semiferous tubule. It is outside the semiferous tubule. Okay? So let's look at inside the semiferous tubule. Remember, I said there are 3 cells in the lobe. 2 are inside the lobe, and then 2 are inside the semiferous tubule, and 1 is outside the semiferous tubule. The one outside the semiferous tubule is called interstitial cell of Leydig cell. Okay, let's look at the 2 inside the lobe. So this is inside the semiferous tubule. This is inside it. Tell me the colors you see. Yes. Rena. Right?
Pink.
You see
Blue,
what?
pink. Hello, Doc.
Yes, go on.
I see light blue. I see light pink.
Asan, review.
Doc, please, I've seen some whitish things there too, and then black.
Can you come again with your colors, please?
Yes, please, Doc. I said I can see light blue, I can see light pink, white, black.
Can you see a pink?
Yes, please. I said that too.
You can see a pink. Okay. So the pink color has a nucleus that is a bit whitish. Hey, who is having another conversation outside my class?
Mute yourself.
That's why most of you have been put outside though. Okay. Now, the pink color has a whitish nucleus. That cell is called Sertolic cell. Sertolic cell. And the blue one with a dark nucleus is the spermatogonial cells. That's the cell that will develop to form the sperm cell. Okay? But if you look at Sertolic cell and then the sperm cell, what are they doing? Which one outnumber the number? The blue one or the pink one?
The blue one.
The blue one.
The blue one. Okay. So it means that the cytosolic cells, which are the pink one, if you look at it carefully, let's trace one. Follow the cursor. You can see that it's forming a barrier with the other one here. It's like that these cells cannot have anything to do with these ones. So the cytosolic cell forms barrier. It's like that the blue cells, which are the developing sperm cells, are compartmentalized. They are put in a particular compartment, like that they don't influence the other. Okay? So here, you can see the compartmentalization or barrier to make sure this one doesn't interfere with this. There's another barrier here. There's another barrier here. Okay? So why are they barricaded? Why are they separated? They are separated because they are two different levels. Before I talk about the levels, let's talk about something. What's the difference between haploid and diploid cell? Haploid and diploid cell. What's the difference? If you know, you raise your hand. Comfort.
So say haploid is half the number of cells in that particular organ, and then diploid is double the number of the number of cells.
Okay. Can I come again?
Okay, so I said haploid is half the number of cells within that particular organ, whilst diploid is double the number of cells.
So what's the number of cells that we are talking about? We are talking about cells. So what number of cells? It's not cells, it's chromosomes, please. Come
Okay,
again.
so chromosomes. So haploid is half the number of chromosomes, and then diploid is within a cell, and diploid is double the number of chromosomes within a cell.
Okay. So when a chromosome's number is half, which is 23 chromosomes, we say it's haploid. When a chromosome's number is 23 pairs, that is 46, we say you are diploid. Now, somatic cells, which are cell bodies, apart from the sex cells, all cells within our body, they are diploid, 2D, 2N, 2N, 2N. It means that they have 46 pairs, 46 chromosomes, or 23 pairs of chromosomes. Okay? But why would the sex cells, like the sperm cell, the follicle, be haploid? Why? Because it needs to be haploid, so that when it meets with the follicle, that is also haploid, they bring about a diploid organism. So that's why it needs to be haploid. Okay? So if you look here, how would it be? From the primary spermatozoid to secondary spermatozoid, they undergo cell division. From the secondary to the spermatid, they undergo meiosis. Meiosis is reduction of nuclear material or reduction of chromosomes within a cell. We call it meiosis. Okay? So spermatid here is a haploid organism, whilst this one is a diploid organism. The last one is also diploid organism. Okay? So here, it means that this cell is 2N, this is 2N, and then this is 1N, haploid. Okay? Now, the cytosolic cell, if you look at it, it means that it's protecting, it's supporting, it's feeding the spermatogonia cells. Okay? So the spermatogonia cells will develop through this stage that we call spermatogenesis to form the spermatid. And the spermatid are half the chromosome number of the secondary spermatozoa. So what happens? Now let's explain two things. So inside the semiferous tubule, there are two cells. Outside, there's one cell. Inside, we have the cytosolic cell that protect the germ cell. Whilst the germ cell itself undergoes cell division in various categories to form a haploid spermatid. Okay? Now, cytosolic cell also forms a barrier. Remember, we said that haploid, when something is haploid and your immune system gets alert, it will destroy it. Because the immune system that operates is even 2D or 2N, diploid. So when a haploid system is exposed, it will destroy it. Okay? So these are the two cells inside the semiferous tubule. the cytosolic cell itself, and then spermatogonia cells. Okay, so let's quickly look at. So this is the function of the cytosolic cell. The function of the cytosolic cell. Okay. We say that the cytosolic cells. Okay, they support the cells, they protect, and they feed the spermatogonia cells. They also form ascoias. Okay, they also secrete fructose-rich fluid into the lumen. And the last aspect that they do, that is very important, they are influenced by FSH. They are influenced by FSH. They also secrete inhibitant. They also form blood-testis barrier. I'll talk about it soon. Blood-testis barrier. Now, the BDT or the BTB, blood-testis barrier. You see, because the sperm cells, the spermatid are haploid, there should be a barrier between that and your immune system. Your immune system is also in your blood, so there should be a barrier between the testis and the blood so that they don't go and destroy your own immune system. How do we know the immune system is destroyed? Now, there are factors that will allow the immune system to fight your spermatid. Number one, if someone is kicked in the testis of the scrotal sac, they are kicking the scrotal sac, and then it becomes inflamed, or it becomes big, or there's blood in it, and no proper care is taken, it can break your immune system. Okay? Something of that sort happened to him. When he was a kid, somebody kicked him in the testis, or he had an injury or trauma to the testis. Whilst marrying or going into a relationship, he has forgotten that time he was a kid. So usually, it means that the barrier has been broken. So far, it's inflamed. So that person's own immune system will kill all his sperm cells. Is that clear? Hello? Is
Yes,
that clear?
sir.
Hi. Yes, sir.
So
Yes, sir.
that's number one cause of A spermatozoa. When the person had injury, trauma to the testis, and the barrier has been broken, the person's own immune system will destroy the spermatid. Another barrier, another cause of A spermatozoa is this, the one on your screen. The temperature of the testis is different from the temperature of the body. 35 degrees Celsius is regarded as critical temperature for the testis. Critical means it can kill all the sperm cells. Okay? So the testis can do away with this. What's the body temperature? Yes? What's the body temperature? What's the body temperature? Hey, move him. Move him.
37.2. No, 37.7.
Yeah, comfort. Comfort, your hand is up.
36.2 to 30.
30 what?
36.5 to 37.9.
37.9. Are you sure?
36.2 to 37.2.
So let's take it 37. It's okay.
37.
Let's take it 37. You see, when your body temperature is even 37, the testis of the man cannot support it. That's why it's outside the body. If you want to know why the testis is outside the body, it's because of the body temperature. If testis is exposed to 37 degrees Celsius and above, it will grill, it will burn. And this scenario happens in infancy, start from the infancy. When you have baby boys and you buy these sticky and tightened buster shorts for them, most of them are nylon. You buy nylon buster shorts for them. It tightens their scrotal sac so that it pushes them closer to their body. And most of these boys will be running under the sun. So it means the person temperature is around 40, 50. And how can the test that's supposed to be free run away from the body? That's why the proper buster shots have spaces to allow the testes to move. Okay? So this is very important for you to note. Temperature can also cause a spermatozoa, can grill all sperm cells. Okay? Okay, so know the two causes. Temperature. So it means that if your husband or your boyfriend is used to wear tight buster shorts, advise him. You should wear buster shorts so that the scrotal sac will have spaces to move. Okay? If you wear tight buster shorts and even wear black trowel on it, the buster shorts itself is black and you wear black trowel. And at the end, you want your testes to be functioning well. It has been grilled. Okay? So advise your husbands. Those of you that your husbands are fan of wearing black trowel, always let them have a white buster shorts inside. Okay? White buster shorts, well space. Okay? Well space. It's very important. And those of you who have baby boys, the kids, remember they need cotton buster shorts and also not tight enough. Okay? Any questions? So temperature is alone is enough to cause a spermatozoa. Okay, let's quickly look at Sertolic cells. Sertolic cells. Sertolic cells are also, oh no, Leydig cell. Okay. Leydig cells are outside the semifluous tubule. I hope you remember. I said within the lobe of the testis, we have 3 cells. Leydig cell is outside the tube, and then Gonia cells and then Sertolic cells are inside the semifluous tubule. Now, we know what Sertolic cell does. Let's look at what Leydig cells also is doing. Can you read point 4 for me? Point 4. Point 4, 5 and 6. Read it.
Endocrine cells that produce and secrete testosterone. Secretion is stimulated by luteinizing hormone. Luteinizing hormone is produced in the pituitary gland.
Okay. So it means that the cell responsible for production of male hormone is what? What cell produces male hormone? Male hormone.
The cells of Leydig.
Okay. Interstitial cell of Leydig or Leydig cell. They are responsible for the production of male hormone. And know the difference between Leydig cell and Sertolic cell. What they do? They do different functions. This is not inside the semifluous tubule. It produces male hormone. So male hormone is produced outside the semifluous tubule. Is that clear? Outside. And then it's under the influence of LH. Now, Sertolic cell, we saw that it's under the influence of FSH. And this one is under the influence of LH. So if somebody has low sperm count, and we give you LH and FSH, which of these would you inject the person with if you want to increase the sperm production? Do you give the person LH or you give the person FSH? Remember, LH is acting on a Leydig cell and FSH is acting on Sertolic cell. These are your exam questions. Let's try to find out. Which one would you give? Low sperm count. You want to increase the count. So which one would you give?
Sir, please, the question again.
The minimum your question again. Who PC? I catch your question again.
LH.
You give the person LH.
Yes, please.
If you give the person LH, the male hormone, testosterone will go up. Going up, testosterone increasing. Does it increase sperm production? No. A capital no. We give FSH. FSH influences the Sertolic cell. And Sertolic cell is inside the tube with the sperm cell. It is the one that feeds it, protects it, clothes it, and does everything to it. So when that is strong enough, it can help the sperm cell produce more. So with low sperm count, we don't give the person LH. We give the person artificial FSH. Is that clear?
Yes.
Okay. So understand the effect of LH on the testes and understand the effects of FSH on the testes. FSH affects Sertolic cells. Sertolic cell is inside the seminiferous tubule with the gonial cell. That's the one protecting, feeding, do everything for it. If you give the person LH, LH will affect interstitial cell to produce more testosterone. So we give LH or testosterone to people who are more female-like, okay? We have males that when they are growing, because the testes, something has happened to the testes, or their testes fail to produce more testosterone, they look like females. These are the ones we give LH. That affects the Leydig cell to produce abnormal testosterone. If you give the person testosterone directly, he will be a man, but it will wear off. It's artificial. So we give the person LH, and let LH will affect the Leydig cell to produce natural testosterone. Okay? What is the effect on testosterone? Testosterone with a man give the man aggressiveness. The man becomes aggressive. So when you have boys 3, 4, 5 years at home, they don't sit to, they move up and down, up and down, up and down. They climb. When you say don't go, they are there. Descend, they've climbed. Move, they are sitting. Sit, they move. Because of the testosterone, they behave like, unless they are sleeping, then the house is quiet. But while they are awake, nobody rests at the house. It's because of testosterone, okay? In them, it's giving them, females are a bit quiet because they don't have testosterone in them. They have estrogen. So 3, 4 years, they try to build themselves, trying to cook and do those things, okay? But males, testosterone will not allow you to do that. That is in infancy. It is the hormone that develops the secondary characteristics of a man. So every man needs it to give the person chest, muscles, hair, and everything, okay? Now let's talk about the hair. Facial hair of men is as a result of this particular one. So it gives the males muscles, hair, male-like features. Now, if a female has testosterone higher in her, she also behaves like a man. That's what I'm saying in the beginning, that some men are marrying other men in the name of female. Some females too are marrying other females in the name of males. Okay? So if this hormone is high in a female, she becomes like a man. Facial hair, body hair, muscles. If you're a man, you fool, she will whip you. Because she's a man inside. And they are very strong, agitative. Okay? And the problem is that when you have high level of this hormone in yourself, your estrogen level goes low. So it is difficult to get pregnant. And it can also result in polycystic ovarian syndrome. Okay? So if you see a lady who is very hairy, you see, in Ghana here, when men see ladies who are hairy, they are jumping up and down like monkeys. But in Europe, when a lady is hairy, she shaves. She doesn't want people to know she's hairy. She shaves because they know these things. If you are hairy, no one will like you. Okay? But here, if you are hairy, the men will be jumping like monkeys. Hey, instead of treating the lady, they will go for her and then have problems in future. So if you are hairy, you're a lady, you are hairy, you have beard and everything when you are hearing me, please take my number from the Telegram and then test me. Don't worry. This one is important. We can reverse the testosterone quickly. Those of you who have this problem, due to that, they can't give birth. We can do all that. We can reverse it quickly and then you give birth. For those ladies, that's the funny thing. That's a very funny thing. When you reduce the amount of testosterone in them, they can get pregnant. But after giving birth, it goes high again. So usually we have drugs. If you're a man and you marry a lady like that, that's good. Because that's a natural family planning. She can't get pregnant, no matter what she does. If you're ready to give birth, you give her the drug. It goes down, you impregnate her. And then, okay? So usually, when a lady is not health inclined, and you marry her like that, that's good. You play with the system. Okay? You know when she wanted to get pregnant. You know when she can avoid it. Because it's an artificial family planner. Okay? So that's the whole thing. So ladies with those characteristics, we can be there. But if you wait and the person reaches a particular age, 45, it's difficult to work on her because the hormones have lived with her for so many times. Okay? At times, some of them, they shout, I think it's a man. If you are sitting, they are sitting behind you, they shout, hey! By the time you turn, you see that, hey, say your back. So these are the things that testosterone. So testosterone in men behave differently. Oh, those who are very fertile, my dear, those who are very fertile, they don't have that condition. They are hairy. People are naturally hairy. Okay? Some people have facial hair. But those that we are talking about, look at their muscles. That lady, you say she's very fertile. Look at her muscles. The muscles also. If you have that condition, it's better to give birth early. Okay? Those conditions that give birth early, that's better. Okay? But normally, if you wait 30 and then forget about it, you need to be reversed. You need to be treated with it. It's a condition that we can treat. Okay. Now, when males have testosterone in them, I've told you what happens. It develops their secondary characteristics, give them the confidence, the boldness, the leadership role. Hey, most uncle no. Hey, can you meet them all, please, and take them out of the group? So please, that's our sense. Now, when men get this hormone in them, what does it do to them? Okay. Apart from the aggressiveness, men become a bit agitative, become frustrated easily. Okay. So now, if your husband comes home and is hungry, and anything small, he shouts, and this, you should keep quiet, go down. You see, when two hormones are at home, testosterone is higher than estrogen. If it's testosterone, it should be estrogen. When it goes high, it goes down. That's the only way to control them. Okay? When men are like that, they need only 110. 110. When they shout, you keep quiet. In other words, you give them respect. After shouting two times, nobody mind them. They'll keep quiet themselves. Okay? You dress in the evening, you are going somewhere, say, my dear, you are not going anywhere. Sit, you sit. But you, when you say sit, you say, I'm going. That will bring the divorce and everything. Okay? When men have testosterone in them, their decisions, everything, they will tell you it's funner. My decision is fun as if they are God. My decision is funner. Okay? When you hear those things, you just keep quiet. That's the only way to control them is that you don't mind them. Okay? You keep quiet, look at them. And then you give a soft voice. You make yours soft. Okay? When your voice becomes soft, you see that their ego will go down. Oh, that's the whole thing. But when their voice is hardened, you too, your voice is hardened, then one will beat one in the room. Okay? So the way to treat testosterone is to become what? Estrogen. Simple. Okay? It's simple. Our great grandmothers, they knew this. When their husband shouts, they keep quiet. Simple as that. When a man comes from home or from work, before he lands, he goes to the bathroom, wash the man, bath with him. Sit him down, feed him like a baby. That man will not shout. He won't even make a noise. Okay? With a napkin, wiping the mouth, wiping here, wiping here. You see, the face is activated by cranial nerves. So the more she's scrubbing the face, cleaning this place, and when he finishes, I want a cocoa farm, the man will give it to her without thinking. He will give it to her without thinking. Okay? So I remember yesterday somebody complained, and they don't give us money. You, with that voice, how can they give you money? How would the man even tell you his secret? He won't, without your voice. He will not tell you anything. He shout, you shout. So there are two men in the house. So how will he tell you his secret? When he shout, you go soft. That's the trick. When you go soft every day, so when he's talking, he's careful. But when he talks, then you see that there are two men fighting. So we have to fight together. Okay? That's the effect of testosterone on men. They become agitative. Anything they want to be funner. We'll tell you my decision is fun as if they are God. Okay? It's funner. No one changes anything. Hey, give a soft voice. Give a soft voice. That decision tomorrow morning, it has changed. Okay? It's simple as that. So when you marry, or your boyfriend is quiet type, he doesn't shout, he's never angry, and this, please, you marry a lady, he has no testosterone in him. Go and check his testosterone level. before you know, it's zero. Estrogen high is a lady you are living with, not a man. Okay, so these are the two hormones you'll be playing with. Okay, a husband that is quiet, that's why the lady will be he's very good. He doesn't talk. Anything I say, he say yes, he's a lady. I'm telling you today, he's a lady. So please, he need help. The conception that you'll be looking for, when estrogen is high in you, to your testosterone is low, sperm cell almost zero. So how can he impregnate you? You are living with another lady. So please, let's try to understand these hormones and know how to deal with it. It's very important. Okay, let's look at it in our case. When kids have testosterone high in them, they become agitative. Don't calm them down. Just that, talk them in opposite direction. When you want him to sit, tell him to go, he will sit. When you say come, he will go. So tell him to come, he will go. That's the way we deal with these kids. When they try to grow up, they will pick the system. Okay, they will understand, because during the arrest stage, because the development, they will pick it. But with men, grown-up men, we have high level of testosterone in them. Please know how you deal with it. Some of them will even kill you yourself for them. If they won't give you, they won't give you. Hey, my dear, if he's not, you see, we said behind a man there's a woman. We never said behind a woman there's a man. That saying, you ladies of today don't understand that saying. Behind a man there's a woman. It means it's a woman that is controlling a man. It's not a man that's controlling a lady. So if you are married, you have a relationship, you can't control the man, it means that you have a problem. It's not a man. You don't understand anything in marriage and you jump into it. Okay? This guy is a testosterone guy and you want to control him. Are you mad? No. You can't control testosterone. You can't control that hormone. What you do is you succumb to it. Simple. Okay? So that's simple thing. Men don't need food. Sex, we can get it everywhere. What men need is respect. That's all. And your voice will be... You see, the only thing that kills man is voice. When your voice is soft, you talk softly. When they're even hungry, like they can't know how to handle it. Because when they hear that voice, they hear a voice of a lady. But you, the man will shout, you two will shout. There are two men living there. Oh, one will beat one. Okay? So usually when it comes to divorce issue, you ask those who want to divorce, what's the problem? No one can give you a concrete problem. Oh. Everybody is shouting his peace of mind. Then I don't give you money. Then you know the problem is hormone problem. They need all advice. They need to be advised. My dear, there are so many things. When you go to female reproductive system, I'll talk about certain things. You see, for females, you have a gift, but you never know. Some of you have never used their gift too. The gift is not sex. It's never sex. You have a gift. You never use it. You never use your gift. Some of you have been married for 5 years. They never know what's the gift women have, and they are married. How can you get married when you don't know the gift of women? And you want to be with a testosterone man? He will beat you. He will beat you to death. There's a gift that no matter how the man is, you put him there, he's done. That's all. He's gone. But you don't know these things. That's why I'm saying this course is not for anybody. It's for you personally. For you first. Then your client becomes second. Okay? So please, that is the whole thing. I'm talking about just a hormone. Just one hormone in males. That's what it does. It's a controlling hormone. It's a chief hormone. It's everything. When a man loses that hormone, his respect, his everything is gone. Okay? Now the question is, females don't have testes. This hormone is produced in the testes. Females don't have testes. So how come females can have high level of testosterone in them? Females don't have testes. So how come ladies can have a high level of testosterone in them? Yes? Anybody? Any hands up?
Genetics.
Yeah, who's I said, when you want to speak, raise your hand, my dear. Yes. Females don't have testes. So what in females help them to get this highlight. Yes, Florence.
Sir, please. I think because of the sex chromosomes, because before a female, the man will release the X chromosomes that carries the genetic material, and then the female will also release the X chromosomes. I think because of the chromosomes that is released from the man, that is why some of the females carry the testosterone.
Hey, Florence, I said I have a Florence in my work here. Eh? Florence, your answer is not. Hey, what answer is there? You see, you are the third Florence I've seen within this year, and all of you, you have something in common. The way seriously, the way she will give the answer. If you don't know your subject area, she will confuse you. Hey, Florence. Florence, your answer is it needs some changes, okay?
Yes,
it needs some changes. Yes. Any other person? Yes. Why would Sarah?
Sir, please, I think looking at the pituitary gland, the anterior pituitary gland produces an amount of testosterone, if I'm right.
Sarah, you are not sure. You want me to confirm it? Hey, okay, we're going to look at it. I don't tell people the answer is wrong, but I tell you, I can't crabby. Okay, it's almost like that. Look at it well, Florence. Sarah, I come back. Okay, let's say Comfort is saying that ovaries and adrenal gland, the ovary and adrenal gland. Yes, the adrenal gland, suprarenal gland produces some amount of testosterone. Okay. So adrenal gland, adrenal gland is sitting on top of the kidney. When you have kidneys, you have suprarenal glands. We also call them adrenal gland, and they also produce testosterone. So at times they can produce high level of testosterone. If you're not careful, that lady can be a man. Okay, so men, we have high level because we have suprarenal glands. We also have testes. With the testes produce this line, the Leydig cell in the seminiferous lobe produces more of it. Okay, so the suprarenal gland, that's the perfect answer. Thank you. Ladies have testosterone in them because of the suprarenal gland. That's a perfect answer. Okay, good. Thank you. Thank you. That's a nice answer. Okay, good. It was chatted. Those of you who want to see the person chatted, it was chatted. That's a nice answer. Okay, so ladies, suprarenal glands in them can secrete the male hormone, and at times it's over secretes. That can cause those troubles. So we can reverse that particular aspect in you. Okay, so if a lady has high level of testosterone, we can reverse it. Okay, so understand the hormones and then their production. So now we know that in this lobe, there are 3 cells. Leydig cell, that is outside the seminiferous tubule, and inside the seminiferous tubule, we have 2 cells. We have the Sertolic cell, and we also have the spermatogonia cells. The Sertolic cell feeds, protects, does everything for the spermatogonia cell. The spermatogonia cell will undergo cell division, mitotic, and later meiosis to form a haploid spermatid. And the haploid spermatid will be transported to the epididymis. And then when it matures, becomes a sperm cell, spermatozoa, that would undergo the journey. Okay, so at least now we are settled with where and when sperm cell is produced. Now let's go into the transportation. I said I'm interested in 3 things: production of sperm cell, how it's transported, and of course, semen analysis. Let's go into the transportation. Okay. Now, the production of sperms is known as spermatogonia, okay? And then the production of the testosterone is also there. So there are 2 different things the testis does, okay? Let's look at the transportation. Let's get a cross-section quickly. So these are the tubes, okay? The seminiferous tubule goes to the strict tubule, testis, rectus, epiphysis, epididymis. From epididymis, you go to vas deferens, you go to ejaculatory duct, prostatic urethra, membranous, spongy, and then, of course, you come out. Okay, so this is in your PowerPoint. The transportation is in your PowerPoint. Okay, you should know where it starts from. So you start from semiferous tubule and end at the spongy urethra, please. So find out this. All this is in your, so the transportation is already there. Okay, it's all in the PowerPoint. The transportation from where to where to where to where. It's in your PowerPoint. So know the transportation aspect. So what I will look at it in our next meeting will be the semen analysis. The semen analysis. Okay. Then we are done with the male. And I'll quickly talk about the erectile dysfunction and everything related to it. So let's see if we can do that. We have some minutes. When are you supposed to close?
4 p.m.
Oh, okay. We can do the semen analysis quickly. Well, let's see if the time, because I want you to understand that part very well, semen analysis. So if you are tired, we can do the erectile dysfunction, and then next week we look at semen analysis and we introduce you to female reproductive system. Okay. Okay, so these are the hormones involved. I've talked about them all. They are on your PowerPoint. Don't worry. I'll take these pictures out and give you only the what you need. Okay. So we have accessory glands. I've talked about them. It's very important. Let's do this.
My hand was up.
Yes, Sarah.
Sir, please, I want to ask about the life cycle of the sperm cell. The life cycle, I really want to, if in brief, you can say something about how it starts and then we get the...
How it starts?
Yes.
That's how
like
we start.
The life cycle.
Sarah, how it starts is what we'll be talking about all along. The production of sperm cell. Or? Sarah, are you there?
Sir, I'm here. I'm here. I mean, starting from, I heard the spermatogonia. So I wanted to know from where does it, from spermatogonia, where does it get to? Which stage
in the
before
testes,
finally...
it rests at the spermatid. From spermatogonia, it goes to primary spermatocytes, they go to secondary, and then go to spermatid. From secondary to spermatid, that's when meiosis happens.
Okay.
So the spermatid is haploid, and the spermatid is inside the testis, so it will be pushed to the center of the testis. So it is the spermatid that will move from the testis to the semiferous tubule into the epididymis. And I'm saying the transportation channel is already listed there. When it reaches the epididymis, it will stay there, feed. It will be fed nicely. Now, for it to move from the head of the epididymis to the tail of the epididymis, that's the first time the sperm cell needs to swim. The movement from the spermatid to the epididymis is peristalsis movement of the tubes. The semiferous tube, the erectus testis, they have smooth muscles, so peristalsis movement will push them into the epididymis. Now, from the epididymis head to the tail of the epididymis, that is where the sperm needs to swim. Now, for a sperm to show maturity, after eating a lot, feeding a lot in the head of the epididymis, it needs to move through the barrication, through the, you see, the body of the epididymis has epithelium that has glands and has like pillars in it. So the sperm has to move past the pillars, dodge each pillar, and move to the tail. When the sperm is able to move to the tail, we say the sperm cell is matured. If a sperm cell fails to move from the tail, it will stay at the head and then die because the food will be finished and to die. When they come to the tail of the epididymis, that is where they are matured and there's a lot of food there. They will eat when they are needed. When they are needed, it's during sex. Then they move out. Because the tail of the epididymis is like an air conditioning room. Everything is there. But when you move out of that place, you are in trouble. The place is hot. This brings about blue balls. Let me quickly explain since you brought the question. Now, you see, sperm cells are saved at the tail of the epididymis. That's where they are saved. The tail of the epididymis, as I said, it's like an air conditioning room. Everything is inside. Food, kitchen, maybe they eat and they are okay. But if a man sees something, or you touch a man, you touch a certain part of the man, then these sperm cells start moving from their comfort zone. Okay? The man is sitting somewhere quietly. You've exposed your breasts. Your attire is glued to your skin. See if You can't separate it. You can see all your body frame. Shape, okay? We can see everything. Okay? Face, polish, everything. So when a man sees things like that, that is why fashion, today's fashion is to expose the body. Because to attract a man, the problem of men is their eye. So married women, when you are moving with your husband, tell them to look at the thing, because either you tell them or not, they will watch. So tell them to watch so that they will know, so that they will look at it freely. Okay? Because the issue is that when men see things, they are attracted to it. Then the sperm cells start moving from their comfort zone. When you touch a man in a particular way, okay, even when you are feeding him, the way you touch him will let the sperm cell move in. That's why I'm saying there's a gift to women. You are married. You have this gift of touching, holding. Table nisi baby, also tea baby, and you expect to get money. Sit closer to him. If he sit on his lap, feed him. Touch all the place before you know the sperm cells are moved. When it moves, the man's brain is not working. Anything you say yes. You put food on the table and you are sitting there somewhere conversing and you want to get anything then marry. You won't get anything. Still you learn. Till you learn. At times, when I hear these things like people are divorcing, look at it. The man is not, you see, men, our first women that we met is our mothers. And the mothers, especially Ashanti or Ghanaian mothers, they take care of their baby boys like as if they are dying. Okay, they pamper them. They do everything. So when that man gets married and this thing is gone, he feel like, hey, I worry me. Okay, so be a woman. You have to still date your husband as if you not married him. When you marry people, always pretend as if you are dating them. That's where the marriage becomes solidified. You cook his food, put on a dining table. He comes, you wash down, he sits on a dining table alone, and you are watching TV. Are you mad? Wake up from your dreams and save your marriage. Okay? These are things that we shouldn't tell you, but I've seen that this time around, our midwives, I know they don't know. Their parents did not tell them. They just went for marriage. Okay? It's important. When this sperm cell move from their comfort zone, no man, anything you say yes, yes, yes. He has only one thing in mind. So anything you say yes. He won't even think about it. Okay? When it moves out, what they see, what they hear, what they touch. As for men, our ears, they don't work. So don't use a man's ears to you can't get it. Anything you say, we respond. We don't even hear it. Our ears don't work. It's you female that your ear, you want to hear things. So we don't talk to men. We act, we touch, we expose. We don't talk to men. If you are married, by the time your husband comes from work, you see, your body should be something. You should smell good. The nose of men work like anything. Whatever they smell, 100 years is in their head. The secretary is smelling good. You at home, smelling like my money. How do you expect him to come at home? Huh? These are things you should know. And education is supposed to bring that out of this misery aspect. Some ladies, when you go home, you see them in one cloth, not their training, one cloth alone, moving around the house like anything. And you think your husband is not worried because you're not talking about it. Today, I'll talk for them. Okay? Dress as if you are going out. It's only when you are going out, you wear your wig, you wear it. When you are going out, who is there? Who is there that you are dressing? Dress at home. By the time he comes, wife, are you going somewhere? No, I'm at home. Say, hey, nowadays you are serious. By the time you come from work, one cloth. Even bath, some people have not taken their bath. They are at home just like that. You think your husband is your brother? It's not your brother. Men are men. If it's 70 years, what they see, they will chase it. So behave as that. It's a perfect gift to ladies, but you don't know how to use it. You think sex, that's your sex that you don't even know sex positions. That I'm going to teach you the sex positions. And you think that sex is enjoying it. It's not enjoying anything, no. When you go to sex position, by the time I finish with you sex position, most of you, your marriage will be 100% increase. Okay? There are so many things you people lack. So many things. Okay? So I make it personal for myself to teach you everything about it. Okay? So please, men in their comfort zone, when a sperm cell at the tail of the epididymis, nothing happens. But when it starts moving, everything about the man's brain becomes yes. It doesn't care. Whatever he wants is what he wants to get. But anything less, it doesn't care. And how to move these things, I've told you. Exposure. Okay? Utifie, watari achichiro kon. When you are going out, it's not that you want to wear miniskirt and you think the man will not frown. Wear the miniskirt at home. Okay? Our Muslim ladies, I don't think it's haram. When you are with your husband and you wear your miniskirt, it's not any haram. When you're going out, you clothe yourself. As for you, I trust you. When you're going out, they're married. If you want me to see their eyes, they've closed everything. Okay? As for we, the Christian ladies, going out, it's not that you are wearing the miniskirt, the heel that exposes the body features. But at home, you have only on one cloth, moving up and down, and you think my marriage is not. It's yourself. That man is not your brother. It's your husband or it's your boyfriend. Date him every time. Every time of your life that you get, date him. He's still a man. After married for 15 years, you think the man is your brother. He's not your brother. If he's 100 years, he's still a man. Please, let this the sperms move away from the safe room. When they do that, anything at all is okay for them. Sit, touch, talk to them. Okay? Not any nonsense talk. Please. Men's ear, I've told you, the ear don't hear. Things that they want to hear is what you have to mention. Okay? It's simple as that. Behind a man, there's a woman. We never said behind a woman, there's a man. Men, we can't be behind you. You are far advanced. Your brain, the development of female brain is too advanced as compared to man. So we are not behind you. You can be behind us, but not we behind you. Okay? It's a simple thing. Now, let me explain my blue ball theory. Now, the issue is that if this sperm cell move from their comfort zone, they are proteins, and nothing happens. They can't go back. Okay? When they move from the tail of the epididymis, they move up there, and nothing happens. No sex show, nothing. The sperm cell can't go back. What the body will do is that it will denature them. Denaturing them means that the body temperature of the man will increase. The scrotal sac become hot, and then the sperms that are moved out of the control room will be destroyed. Okay? So anytime a man wants to have sex with you and nothing happens, he's in pain. Oh, that quietness is there. He's not talking. You think it's because he is in pain. Because so fast he tempted anything and nothing happens, it has moved. The sperm cells have moved from their comfort zone. You put him in pain like this, and in the morning you want money. What money? You put him in this unbearable pain. At times, some of them have to go and shower quickly. I think showering will let it go. It won't go anywhere. You need proper medications to let it go. Or you sleep quietly. That's the whole thing. It works. He touches you, you jump here. He touches you, you jump here. Then you say you want money to do it, to buy a wig. Okay? Because that thing has moved. When it moved, there's no turning back. It's one-way direction. There's no way it can come back. The only way it can come back is that the body needs to destroy the sperm cells. Okay? When the sperm cells are destroyed, then it becomes free. Okay? The destruction of the sperm cells is to increase the body temperature of the man. That is why in local English, we call it the man has blue balls. Okay? Now, when you expose your fiancé to these things, you are a Christian, so the Bible says we should get married before this, but always you go there. Please don't go there, because out of sight, out of mind. He's in the house. When he comes to his house wearing that mini skirt, you smell good. Any man would think, so the sperm cells have started moving. Okay? And then let's wait till we are married. Before you married him, we have a condition. It behaves as if he has done vasectomy. Because the more the sperms are produced, and then nothing happens, the germ cells will think that man does not need the sperm cell, so it will grill it. So don't expose men to this painful blue issue. Because the more they do it over the years, it's likely they are going to have low sperm count. And eventually, that can happen. So if you are dating him, date him on phone. Don't visit him anyhow. Because if you are not ready, don't go. Okay? I'm going to see if he has another lady. What's your problem? If really you trust him, what's your problem? Or you can't do your work well. Okay? So please, this is important. Very important relationship. I've told you, marriage are going up, down. They married today, 2-3 years, they are divorcing. So many things are happening because of these minor things that we play with it. Okay? So in vasectomy, you touch the scrotal sac laterally, then you see the duct. Okay? You make an incision through the scrotal sac and then you open, you see the vas different, you bring it out and you cut, and you tight both ends. That's how we do vasectomy. Very simple procedure. However, when you expose the body to blue balls every day, then the body would think that you don't need the sperm cell. Production will go low. Okay? Yes, Florence, your hand is up.
Please, our young female male boys, when they get to certain ages, I think they also erect. So what about this? Can it also contribute to this blue ball theory or what?
I can't get you. You say males do what? I didn't get one.
I'm saying our young boys, like our babies, boys.
Oh, yeah, yes. No, for them, it's the sleeping hours. When they sleep that long. You see, when you sleep, let me tell you what happens for erection during sleep. When you sleep, okay, every organ in your body is at rest, except three. One, your brain, two, your heart, and then one, your brain, two, your heart, three, the kidneys. They are not at rest. Now, when the heart and the kidneys are working, now, whilst they are pumping blood, the heart is pumping blood to all parts of the body. The kidney too is refining the blood to make sure that the excess aspect is taken out of it. Okay, good. So the heart to pump blood into the penis after sleeping those hours. And then the kidney is also withdrawing the excess into it. So the kidney or the bladder will be full of urine. Now, the veins that allowed a flappy state of a penis, we call them campaniform plexus. They are just anterior to the bladder. When a bladder is full, it compresses the veins. So that man cannot get, the only way for him to have de-erection is to go and urinate. So when he urinates, then the blood can flow backwards through the vein. Okay? So when a man sleeps, that's why I say any potent man, when he sleeps that hours, when he wake up, he should wake up with erection. That has nothing to do with the blue ball. The blue ball is when you went there, touching him, doing all these things, saying certain things to him and this. And then these sperm cells trying to move. Okay? They move. When they move, and then later I tell you, I've forgotten my menses. We are Christians, so let's wait till we get married and this. And the man, okay? This thing, the sperm cells that have moved from their comfort zone, they can't go back. So they need to be destroyed. That's the blue ball. Okay? But for a baby to sleep and have erection, not only babies, men in general, when you sleep for long hours, you should wake up with erection. If you're not diabetic, if you're not hypertensive, if you're not stressed, if you don't have any other condition there. Okay? So that's why men, when you wake up, you should wake up with erection. So when you are dating someone, you want to see if the thing is working. Visit him very early. Knock his door. When you wake up, look down there. If it's erected, you know. Because if you sleep that hours, you should have erection. Okay? So that's why when men sleep that hours, they have erection. It's the heart and then the kidney issue. Okay? That's all. I hope I've answered your question.
Yes, please.
Okay, so that is the whole thing, okay? Don't worry. I'm on you today because I'm doing male reproductive system. When I come to female reproductive system, it will reverse, okay? Some men don't know how to handle it. We're going to look at all these things, okay? So that when you read female reproductive system, okay? If you listen to it alone, you won't feel anything. So add them to the class so that they can listen to it too, okay? So that's the whole thing it is. It's very important you understand these things, minor things. Why would a man wake up with erection? Okay, unless he pee. When he pee, after urinating, then of course, it goes to the deflating stage. Okay? Okay. Any other question? Now, let me do this before we close. Now, the accessory glands, you see, the sperm cells have moved from the tail of the epididymis. They are going, oh, Abigail is here. Abigail, yes? Abigail?
Yo, when I
Yes. Oh, Abigail. Oh, she's not aware. She has raised her hand. Hey, today. Abega is here. Let me continue. Okay. Okay. So, now these three accessory glands, they add up to the Esther Dapa, yes, Esther.
Sir, please, what causes premature ejaculation?
I want to talk about it next week. Because next week we're going to do the penis itself. Look at the penis, look at erection, look at those things. Okay. But if you ask premature ejaculation, you see, sex itself is a game. It's playing the mind. Okay. Sex is playing the mind. That is why whatever a man sees, it attracts him. Okay. When you touch him, it goes to his brain. So sex is not a game. It's a whole serious matter. Okay. So men themselves should not be addicted to sex. If you do that, you die early. Okay. They are the do's and don'ts of sex, which next week I'll mention. That's why I'm saying bring your husband there. Those who like sex like water, bring them there so that they understand the do's and don'ts of sex. Okay. So erectile dysfunction has to do with the whole thing. You don't take the sail out of my wing. Let me have next week and then we can do that quietly. Okay. Because somebody asked that question. I diverted going to answer. You asked before I know I won't finish the seminar vesicles. Okay. Yeah, Lydia, I hope it's not a different thing. Lydia.
Sir, please. So what causes some men that when they erect, they want to penetrate? From the explanation you gave us.
Lydia.
Say.
If that man, you are the wife, sitting, lying closer to him with your gluteus maximus, and this has erection, he want to distress himself. Simple. You see, prepare your mind though when you are sleeping behind them, closer to a potent man. Please. That's why I asked you that question in the beginning. Okay. So the man is potent. I didn't sorry.
But sir, it's a one farmer now. Would it cause anything?
Will it cause what?
Anything. Does it cause anything? Because some of them they become so aggressive that. But I just when you answer and come in
but sir mention this here.
Oh, these things I mentioned it. I've told you that when I think, Lydia, were you in class or you went out? It's not that you're coming.
So I don't think she was around because she's just asking questions that you answered already.
Lydia, don't worry. Let's go to Telegram and then answer those questions, okay? Because this question, I've answered it 2 times, okay? Okay? Okay, let me continue with this before. It's even 4. Hey, Mom. It's 4. Okay. Let me see if I can talk about one of them at least. Now, the sperm cell has been transported to the ejaculatory duct. When it reaches there, the name is going to change to be semen. How will the name change to be semen? Let's get to know. Go there. Now, there are 3 things. We call them accessory glands. Accessory because they play other roles somewhere else. So we have one here. This is the prostate gland. Prostate is just beneath the bladder. Okay. And then we have the bobouterine gland here. And then we have the seminal vesicle here. These are the 3 things that we call the accessory gland because they do other things. So accessory means they are helping reproductive system, but they are involved in other systems. Okay. So in this is the posterior view. The posterior view, we can see the seminal vesicles here. We can see also the prostate gland in this manner. Okay. So this is a posterior view of it. So let's look at the composition. Now, we say the seminal vesicle, their color is yellow. Their secretion, their color is yellow. They are viscous in nature. And then they made up about 70% of the ejaculate. Okay. What's the color? Yellow. They contain what again? Please look at this part carefully. This is going to differentiate between sperm cell and then this. So seminal vesicle, they secrete about 70% of the fluid that the man will ejaculate. Okay. The fluid that they will produce is yellowish, viscous. When you say something is viscous, it means it's thick. It's thick. Okay? Thick. And now let's look at the other one. So this is the composition of their secretion, the yellowish secretion. Okay? The prostate gland also will secrete about 30% of the content, because 70 is from the seminal vesicle, okay? And then 30% is by the prostate. So the prostate one also, yes, is whitish in nature, okay? So seminal vesicle is yellowish. Prostate secretion, 30% is whitish. What is the color of semen? Seminal vesicle, 70% is yellow. Prostate, 30% is white. So what's the color of semen? That's the first thing that you need to know, yes?
Cream color.
Cream color.
Milky color.
Milky color. Cream color, milky color. Any other thing? So when you're doing semen analysis, the color is important. The color, when you see a man's semen and then it's yellow, what do you have in mind? It's yellow and thick. What do you have in mind?
Then say it means that the seminal vesicles have secreted more than 70%.
No. It means the prostate is not working. Simple as that. It happened to old men. Okay. Now look at the composition of the prostate. The prostate is whitish and then contain what? These are all acid. Acid to make sure that the viscous seminal vesicle fluid is what? Lightening. So sperm is not thick. Those of you that when your husband travels and comes, you have sex with them and look at it, say, or call your first girlfriend, ni hunso ni light. What would you mean? You want that man to die, to have his semen to be thick. When your semen is thick, how would the sperm cells swim? They're in the lake. It should be. So the secretion of the prostate contains a lot of acid to make that thick, yellowish thing creamy and lighter. So don't judge men by saying, "Buy just any who's winning me do." In my or girlfriend. No, they now, or girlfriend. So understand these things. The next thing is that, so how many are we talking? We're talking about the prostate, yellowish, the prostate is whitish, it contains more acidic component. The seminal vesicle is yellowish, it's viscous in nature. So when they mix together, it gives a creamy-like color and then lightening because the acid is supposed to make it light. So when a man ejaculates, it's yellow and it's thick. It means that the prostate has a problem. Simple. The secretion of the prostate are absent. Okay? If somebody secretes and it's very light, it's so white, it means that seminal vesicle secretion is absent. That one has a problem. Okay? So know when and where, which one we are talking with and which one we are dealing with. So please get the color right. Okay, we said the prostate secretion serves as liquefied of the coagulate semen. Okay? For the bulbouretrine, please, the bulbouretrine does not add to the semen. The secretion of it lubricates the membranous urethra before semen is released. You see, when a man erects, you see that slimy thing that comes out of the penis. That is secreted by the bulbouretrine gland. Because the man urinates through that same part. When he gets erection, the bulbouretrine secretion is to wash it, make the thing lubricant, so that the semen can swim quickly through. Okay? So that doesn't add to the content, but it comes out first and secretes and wash the pathway of the urine so that the secretion can come. Please, that one does not contain sperm cell. I'm repeating, the bulbouretrine secretion, Bemania erection, the one that comes out first, sperm cell on him. As I remember one day, a lady told me, oh, the air through neguna say, anything one him, if I Jimmy saw the air through no sperm cell on him, in the other aquanium. Baby aquanium, fako. Okay? So that's the whole thing. That bulbouretrine gland, the content is to wash the urethra, make it very lubricate so that things can pass through quickly. It doesn't add up to the content of the semen. Okay? So those who have that ideology, and who so throw no, egu ase pe wanyem. Mufa mujimi so wate. Okay? That one contains no sperm cell. Please. It just clean the urethra, because nipa wajon so far, a bit clean. Okay. So your take-home message. Those of you your husbands have erectile dysfunction. You see, there's no drug to that. Though we have medication to that, but the quick one we have to do is to give him what? Feed him well. Then an hour before sex, let him drink a lot of water. It will mimic the ahomachinten. Okay? When you take water 1 hour before sex, the kidney will drain them to the bladder. And then he has constant erection till he becomes tired. You don't rest. Okay? So those that your husband have those problems, that's a quick take-home message I'll give to you. Every day I'll give you a take-home message. Okay? But if that one fails, then we need medical attention. Okay? So I'll end here today. I have another quick lecture. So know that you know the color of the semen, know the composition of the semen, and then know how it knows. So it's supposed to be a base. It's supposed to be very liquefied. It's supposed to be it's not supposed to be whitish like water. It's neither supposed to be yellowish and thick. No. Okay. So these are the colors and the texture that we take into consideration. In our next meeting, we are going to look at a whole semen analysis. You have done transportation, production, transportation. So we're going to do the semen analysis and we start the female reproductive system. Hopefully, we're going to do that. Please, on the Telegram, I've seen your hands up, Rena. I see your hand up. I wanted to end. So if you have more questions or anything, let's go to Telegram. Ask me there. Those of you who have personal issues, okay? The personal issues people. Take my number on Telegram and text me your personal issue, okay? Good. For the men, this is for the men, okay? So next time we're going to do about the erectile dysfunction, then we do semen analysis, and then we end with the man. Okay, good. Any question? I'll take just 2 questions and close. Please, does quantity matters? Yes, the volume of semen is quantified. If the volume is under 1, there's a problem. If the volume 2 is too much, there's a problem. So quantity matters. Yes. We have an average quantity that we use. Okay. 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 So what about if the sperm cells smell like fish? He has white blood cells in it. We need to deal. He has a problem that needs to be dealt with. Okay. Sperm cell don't semen doesn't smell like fish. Semen there, it doesn't smell like fish. And then what the market no yeah, Juma. Where Juma market? Okay. When you market, it doesn't smell like fish, please. If it smells like fish, it means that it has infection. Most of it will be filtered by white blood cells, so we need to deal with it. Okay. It has a unique smell, yes. Very, it's a protein, a lot of proteins. We're going to talk about it. You see, men who are sexually active and ladies who are sexually active, when you look at their skin, you even know. They glue. Come on, bright it. Come on. About sorry, I'll say, Mikumba Mencha, Huna na Twincham no. Okay? Huna Twincham sa, only the entire, but don't go in maybe. Who didn't tell Huna Twincham. Okay, so that is it. Mercy, your last question. Mercy, what is it?
Yes, sir. So please, our next class starts 4:15.
Oh, I'm going out. Don't worry. Thank you for reminding me. Okay. Okay, fine. So we meet next week. You so far, I think you are more advanced. You've reached very far as compared to the other group. For big crowd, okay, good. So please take my word seriously and work on your marriage. Work on relationship.
The last question. Last question.
Hey, yes.
Don't quite your pre-cam. Maybe it's me and your mobile. Pre-cam.
Yeah.
Pre-cam. To na ye di kind bano.
And I make can say feeling me patcho. Enti me mo baby ya. Right. Yeah, what's the last question? Obi last question, what's the Oh, Kafra, you be share next week. Okay, good. So ladies, take care of yourself and please be serious. Okay, your husband is not your brother. is still a man that you marry. Tempt him every day. Date him every day. That's the only way out. Okay? And remember, when he's eating, sit closer. Use the grandmother's star. For everything. You see, when you start doing that, your husband will even be serious. Hey, about you then abe. Kade bia miam di medwan na de die ni. Catch and say you're too full. Right? You're too full. What's this? You're too full. Okay? Good. So we'll see you next week. Bye-bye.
Bye-bye. Thank you.
Bye-bye. Bye-bye. Thank you. Thank you.
Please don't go. We have the next lecture. Don't go, please. They'll lock out. They'll lock you. They'll lock you. Don't mind it. They'll lock the door.
Please, I'm already on your platform. Make sure you don't say anything against me. This is just a friendly advice. Thank you.